Welcome to the Just Ingredients podcast. I'm Cara Lynn, and here we talk all things nourishing to the mind, body, and soul. This is a place where you can find just good ingredients to life. Dr. Ben Miraglia graduated from the SUNY at Buffalo School of Dental Medicine in 1993. He has over 30 years general practice experience in Mount Kisco, New York, including over 20 years of interseptic orthodontic experience where his focus has been on early childhood jaw growth and development. Dr. Miraglia lectures nationally on early childhood malocclusion, its impact on sleep-disordered breathing, and the dental team's role in diagnosing and treating this early. Dr. Miraglia also has over 20 years of clear aligner experience and is the VP of GP Clinical Education at Candid Pro. He is the Chief Clinical Officer at Airway Health Solutions. He is the Chief Clinical Officer at Tooth Pillow. He is on the board of directors of the American Academy of Physiological Medicine and Dentistry. Welcome back to the show, everyone. Today we have Dr. Miraglia, who I think is going to answer a lot of questions for you about possibly yourself or your spouse, but maybe your kids too, and just how they're sleeping and breathing, and maybe some health issues that can come along with that. So I'm really excited to talk to him today. So welcome to the show, Dr. Miraglia.
Oh, thank you very much for having me. I'm excited to talk with you.
Before we get going, will you just tell my audience a little bit about yourself, your background, things like that?
Sure. Yes, I'm a general dentist in Mount Kisco, New York. It's a small town about an hour north of New York City. I have been there for 31 years, but about 21 years ago, I started to do early growth and development type treatment for kids. And way back when, it was called interceptive orthodontics or early phase 1 orthodontics. But then over time, it evolved into what's I now refer to as growth and development. So over 2 decades, starting to treat the children early between 3 and 12, getting the jaws to grow better, having the teeth, the bite, the jaws grow to place. Turns out it makes a better breather, which makes a better sleeper. And then you have less orthodontics to do when you're 12, 13, and 14 later on. And you basically have an opportunity to have full health as well as beautiful teeth. So that kind of transition happened 2 decades ago, and we haven't looked back since doing it.
Well, I'm fascinated by this because my husband is a mouth breather. I have 2 sons that are mouth breathers. And so I've got a lot of questions for you today. But first of all, you call it sleep disordered breathing, right? So what is that exactly? Is that mouth breathing or something totally different?
Yes, sleep disordered breathing can be mouth breathing. So there is a specific diagnosis that people have heard of called sleep apnea. And so obstructive sleep apnea is a specific diagnosis. That means you actually had a sleep test. And in the sleep test, they learned that, oh, these credentials qualify as obstructive sleep apnea. But sleep disorder breathing is a generic category, and it's basically the big umbrella that is all bad breathing until you have an actual diagnosis, because you could have obstructive sleep apnea, but maybe you're just snoring. Maybe you're just a snorer, or maybe you're just mouth breathing, or maybe you just have some nose resistance where you could breathe through your nose, but it's not very good. You can hear and see it, like labored breathing. So there are different levels of breathing, and sleep disorder breathing is basically any level of poor breathing up until you actually make a full diagnosis to know what is my actual breathing issue. And so sleep disorder breathing is roughly, just if you're not nasal breathing silently and invisibly, you probably have sleep disorder breathing. And then how far will you go to test it? Do you go to a sleep clinic, get a test to say which one are you,
Interesting. Okay, so I'm curious about mouth breathing. And so mouth breathing, I know, can be really stressful on the body, correct?
Yes, mouth breathing is very unhealthy. And I think that's one of the things that our people are just learning and getting to. And I didn't know this. So a while back, I did not know this. So I've accumulated parts of the puzzle along the way. But there is a big difference between nose and mouth breathing. And the big difference is that the nose was built to prepare the air for the lung. So we breathe in our nose, it prepares the air, it gets into the lung, and next thing you know, the lung gets to make the exchanges, because that's what the lung is doing, exchanging things. Get the good stuff in, the bad stuff out, but at the right rates, keeping good balance. That's how we're fueling ourselves perfectly by breathing through our nose. But when we breathe through the mouth, yes, it lets the air in, it goes in the lung, we still make exchanges. but it's not the same as the nose. The mouth does not clean or filter, prepare, humidify, add ingredients like nitric oxide is a big thing when you start learning about what's going on. So if the mouth doesn't prepare the air for the lung, then when the air gets in the lung can't make the best exchange for us. So the analogy I like to give people, the difference would be, let's take a high-performance race car. And when you have a high-performance race car and you put the right gas in it, you're going to do really well at the track. It'll be peak performance. But if you take a high-performance race car and you put the lowest level, a watered-down version of gasoline in it, that car will not do well. So breathing through the nose is that high-octane, perfect fuel for your performance Ferrari that you're walking around in every day. And meanwhile, with that performance Ferrari, if you're breathing through your mouth, you are putting in a watered-down, tainted gasoline into yourself, and you can't function the same way. Everything downstream goes south when you breathe through your mouth, whether it's day, night, or both.
That makes sense. Okay, so I talk a lot about trying to manage your stress on my page, and I talk about, getting out of that fight or flight that so many of us are in all day long. And so does mouth breathing actually put your body in that state of fight or flight?
It does. And so here's what happens actually. So when you're nasal breathing perfectly, you're not in a state of fight or flight from your breathing. But when you can't breathe well through your nose, there's a reason your mouth opens, and it doesn't happen by accident or even by I don't feel like I'm breathing well through my nose. Let me hang my mouth open to breathe through my mouth. Nobody's doing this consciously. So we think about sleep. We'll start with the sleep category. During sleep, when you lay down to go to bed, most people will have their lips together at first. But if we're not breathing well enough through our nose, our brain will recognize that's not very good breathing. I'm going to help you. And when the brain helps you, it means it will open your mouth. It's a relief valve. It's like a safety net. So the mouth is the safety net. And the way that the mouth opens to help you breathe better, because you're not breathing through your nose, is through the sympathetic nervous system, meaning fight or flight. So actually, the brain is activating fight or flight in order to help you by opening your mouth to make sure that safety net is available in case this goes even worse. So yes, mouth breathing is the start of fight or flight to protect you.
That's terrible, though, because being in that is so bad for your health to chronically be in that. And so at nighttime, that's the one time that you're supposed to go to sleep and not be in that fight or flight. And so that could cause a lot of long-term health conditions, couldn't it?
Yes, and it is like slow deterioration, so it's, we talk about these two words, acute and chronic, right? Acute is an injury like you're riding your bicycle, you crash, you break your leg. Okay, a moment ago, my leg was perfectly healthy and I'm riding my bicycle, but then when I crashed, I broke my leg. That's an acute injury. So you went from healthy leg to broken leg in an instant. But when we talk about mouth breathing, it's not an acute injury. It's not an instant injury. It's a slow deterioration. So most people, they don't kind of put these pieces together because you're slowly getting worse and worse and worse. You're becoming more unhealthy with every night that goes by mouth breathing. And it's like death by 1,000 cuts. It's just slow that your body's working against itself. And the ingredients that you're getting because of the sympathetic drive are basically harmful in excess. It's one thing to have fight or flight when you need it occasionally, but it's another to have it running all the time. And so, yeah, fight or flight at night is putting the ingredients in our body on a regular basis that slowly deteriorates our systems, and then all of our systems start to malfunction at some point. Some people it affects a little bit sooner than others, but that chronic change to unhealthy is coming.
Okay, so I want to ask you a couple questions regarding health things, if they're connected to this mouth breathing, because you hear a lot out there on social media and things. And so one I've heard quite often is that bedwetting is linked to mouth breathing. Is that correct? Or is that a myth?
Yes. Yes, the short answer would be yes, it is connected to mouth breathing. And more specifically, it's actually connected to what the mouth breathing will do to your sleep, as far as we call the professional words are sleep fragmentation. So when we go to sleep and we're breathing really well, we'll be in sleep cycles. So we have this beautiful sleep cycle. We're supposed to be in stage 1, then stage 2, then stage 3, then stage 4, then you go to REM for a little bit. So there's like this beautiful sleep cycle that is a 70 to 90 minute cycle that we repeat 3 to 4 times a night. And that happens beautifully when you're breathing through your nose nicely. But where your brain activates sympathetic drive, fight or flight, helping you breathe through your mouth breathing causes the sleep fragmentation, meaning it breaks up the sleep cycles. When it breaks up the sleep cycles, we call it sleep fragmentation. Well, breaking up the sleep cycle basically puts a child into different levels at different stages for the wrong amounts of time. So all of a sudden it's like a scrambled egg all of a sudden while we're sleeping. But it's that ruins our sleep. Then by ruining our sleep, the next day we're not well rested and it repeats over and over and over. So what they learned in a very large study many decades ago was that children who bedwet have fragmented sleep cycles. They have the same kind of sleep cycle that you have when you're breathing poorly. So breathing poorly leads to the bedwetting for a couple of different pathways, but basically through fragmenting your sleep. So if we think about bedwetting, releasing water. So we release water for a couple of reasons, and you backtrack into how this all goes south. So one pathway is that with sympathetic drive at night, fight or flight, with fight or flight running, it can increase your body temperature. And an increase in body temperature means that we're going to do one of two things or both to relieve the body temperature. And just like when you go to the gym and you work out, when your body temperature goes up, you sweat. So a lot of people will sweat in their sleep. And the sweating in the sleep is to bring your body temperature down from having it elevated from the fight or flight that's going on. So fight or flight is like, okay, I'm working out. During fight or flight, it's like you're working out. When here I am working out, well, my body temperature will naturally go up. I have to release water. You could release it by sweating, or bedwetting is a fast way to relieve body temperature, avoiding all the water. Another pathway is with the mouth breathing. It's so poor. The mouth breathing is so poor and the ingredient exchange is so bad. It changes our cardiovascular system, meaning now our heart works differently. But our heart working differently means it's overworking. So when we breathe in our mouth and we don't have the right ingredient exchange, the heart starts working harder to push the ingredients it has around to share with the body. But the heart working harder means higher heart rate, higher blood pressures. But when the heart is working harder and moving the blood more, it adds up to, well, next you also need to now increase your filtration. So the kidneys filter, and the more you have that excess of heart rate and blood pressure, you have this filtration need. Well, with more filtration comes more urination. So more filtration, more urination. So a need to bedwet. And then last but not least, we talk about how the digestive system, the urinary system, these systems are not prioritized during sympathetic drive. Like in fight or flight, our body kind of changes things and it distributes the ingredients, the power, the source of energy to the things we need to survive, but it takes it from things it deems not necessary for survival. So we pull energy from the urinary system, we pull it from the digestive system. And when you do that, you change how they function, which means now you might have to urinate more often or void just from the trigger of fight or flight. And that's the last stage of it, where all of a sudden you could recognize that, let's say you just went outside for a walk and it's the most beautiful day ever. So you're having a great day. But if a dog got off of a leash or escaped from a house and ran and attacked you, you would right away switch to fight or flight as you're threatened, and you might wet your pants or worse. And it could be similar in a car accident. If you get into a serious car accident, obviously that can happen. You can void. Well, that's an instant trigger at a fight or flight level much higher, but some kids, the breathing is so poor that they have that trigger and they void. So it is directly related to sympathetic drive, fight or flight, or breathing is what triggers the fight or flight. And sure enough, the whole system is malfunctioning. Bedwetting is right downstream from poor breathing.
Wow. Okay, so I have got questions from that. So for little kids, obviously, we know the bedwetting. You just explained that. But does that translate then over to adults of those adults that have to get up multiple times during the night to go to the bathroom?
It's the same reason. So what happens in adulthood is you do reach an age where you actually start to control the bedwetting and you get up to go urinate. Whereas a child will just, be out sleeping. And usually for children, they're in stage 4, which is that deepest of sleep when they bedwet. So they crash into that range and they void before they're really aroused enough to go and they wake up after the wetting. Whereas an adult will now recognize I can't be wetting the bed anymore. And that struggle goes on where you get to a point at some age where I know to get up and go, but getting up to go, that's just a transition. So the child will bedwet, the adult will get up to go to the bathroom. Both are bad breathing. Then there's a whole other difference too, which we talked about mouth breathing and how this is bad at night. But if you're mouth breathing at night, you're not a good breather during the day. So it's not like we're good breathers, because the mouth breathing is for a reason. We have anatomy that might be too small and we can't breathe well. Well, when we're sleeping at night, automatically the brain opens the mouth. But here's the difference between children and adults during the day. During the day, a child has no social awareness for mouth breathing, so their mouth will be open. And if you observe children wherever you go, you will recognize that most children will have their mouth open for significant periods of time. Very few children, you'll notice, have their lips sealed and nose breathe for significant amounts of time. But an adult understands that it is not socially acceptable for my mouth to be open in public. So what an adult does is they force their mouth closed. They will keep their mouth closed, and they will live with the poor nose breathing during the day because it is socially unacceptable to walk around with your mouth hanging open as an adult. So an adult basically just forces the bad breathing, whereas the child will allow the mouth to do the breathing. Either way, we're both are breathing poorly, day and night. So for people, I like to give them this perspective, is that we are breathing poorly during the day, we're breathing worse at night. It's not that we breathe well during the day and we breathe badly at night. That's not accurate. If you're breathing badly at night, you're bad during the day and worse at night. That's a proper perspective.
Okay, I'm going to ask you in a little bit ways that we can help these mouth breathers, but I still have some questions about health conditions, because you're talking about, the heart has to work harder, and then the kidneys have to work harder with the filtration. And if this is going on night after night after night, as you age, into your 50s, 60s, 70s, this is causing a lot of concern on your body, isn't it?
Yes. And so there's aging. Everybody knows the word aging. So we all get to age. So we're all going to get to age, right? We are aging every day. So aging happens. But then there's the word deteriorating. And so they're different. And so what it does is it sets up the conversation to have between lifespan and health span. So every person is going to have a lifespan. And then there's health span, which is what was the age you reached before you were treated for chronic type of illnesses with medications on a regular basis by the medical community? Because your health span can be very short and your lifespan can be very long, but you're living as a medically compromised, unhealthy human being. Now, the goal, of course, would be to be a human being whose health span and lifespan are the same. Because, I lived 90 years healthy, and then I just, I went to bed one night and I didn't wake up. That would be like, that's a perfect recipe for I was healthy my whole life, and I didn't need the medical community to do things with me and to me all my life.
It's my dream.
But, of course, everybody's dream, right? Nobody's looking for cancer and other things. They're trying to be healthy as they can. But the reality is that there's a big discrepancy between health span and lifespan, and that's what we're talking about here, in that when you're poorly breathing, you are not aging, you're deteriorating. So there's a difference. You're just slowly deteriorating over time. And welcome to the domino effect of all of the systems, including, like we mentioned, urinary, digestive, but neurological, cardiovascular, all of the systems really do suffer.
That's a fascinating way that you put that, because I have not heard it as, it's deteriorating, therefore it's shortening that health span versus your lifespan. I love that analogy. So thank you. Okay, so I'm thinking about these mouth breathers as kids who have this sleep fragmentation that you talked about. And I'm thinking, this can't do well at school then, I'm assuming. I'm thinking, does this cause ADHD? Is it contributing to anxiety, mood issues? I'm thinking, when my kids don't sleep well, they're sort of a mess the next day.
Yeah, this is accurate. And I think a lot of people understand that if you don't have a good night's sleep, it affects you during the day, but then string a few in a row. But then make it a week or 2 or 3 weeks in a row. And so basically with poor breathing, you're having a poor quality of sleep. So what I like to do is talk about sleep in 2 categories, quantity and quality, to just set the stage for where we're headed. So quantity is the easier one. We know a child should have X amount of hours of sleep. So going to bed at, let's say, 8 p.m. and waking up at 6 a.m. is the right quantity of sleep. However, if you go to bed at 8 p.m. and you wake up at 6 a.m., but you have been poorly breathing through the night, mouth breathing or worse, you did not have a quality night's sleep. Now, the discrepancy here is that you can have the right quantity. However, with poor quality of breathing, then poor quality of sleeping, there is no amount or quantity of sleep that can make up for the poor quality. So you cannot recover from poor quality sleep. So we're in the quality category, not the quantity. Now, in the quality category, the number one reason for quality of sleep being affected would be your breathing. Then you could make a list that's longer, like, okay, the environment you're in. Are your lights on all night? Is there, loud sounds? Do you have, basically, is it dark, quiet, and cold? Like when you think about sleep hygiene, a darker room is better than a bright room. A quiet room is better than a loud room, and a cooler environment is better than a warmer environment for quality sleep. But before that, nasal breathing is the number one issue, and then those other items. So if we don't have the quality of night sleep, we're sleep fragmented. And it is the sleep cycle that is what cleans and repairs us. So what's happening overnight when we go to sleep? With proper breathing through the nose, it's the parasympathetic nervous system that's running. So we talked about fight or flight, that's sympathetic nervous system. But the other one that's supposed to be helping us at night is the parasympathetic nervous system. And that all that means is rest and digest. And when the brain is breathing well, when our nose is doing the breathing for us, our brain cleans itself, and then it cleans the rest of the body. So it cleans itself, cleans the rest of the body, and you wake up refreshed, you're ready to go. So here's where the behavior and also the focus, attention, and everything kicks in, because the analogy I like to use for people to see what's happening in the brain is Hoarders, the show Hoarders. If you've seen the show Hoarders, and even if you haven't seen it, but I've heard of Hoarders, it basically is where people collect everything that they see and touch during the day, when they bring it in their home, and they don't throw anything out. Everything comes in the house over years, and then the house is so full they can't live in it. It's very unhealthy. Well, what we're going to do is we're going to assign the brain as a hoarder during the day. So through our five senses, right? We've got these five senses: hearing, tasting, touching, smelling, and hearing, tasting, touching, smelling.
Seen.
I forgot the alcohol.
I had to think for a second too.
There you go. Yikes. Like, there we go. Quiz. Okay. So we have these five senses. All day long, our brain accumulates things. It's like a hoarder. So during the day, it's like a hoarder, and that's okay. We're supposed to pull it all in all day long, right? But what our brain does at night is it files it all away perfectly. And so we have this show of Hoarders we're thinking about. Well, it turns out the brain can only do its filing work, putting everything away, cleaning the house, if we're in parasympathetic drive, meaning good breathing. So the quality of night sleep, not being sleep fragmented, means, hey, my brain got to do its job. It cleaned itself all night long. So you wake up empty and refreshed to pull it all in again. But if you don't clean this house and put it all away every night, you have a hoarded house, and the next day you're going to pull in again. And you're going to pile on and pile on and pile on. So we keep piling on all day long, but then the child doesn't have the cleaning ability at night because of the sleep fragmentation going on. So our brain needs to do its job and clean itself. So here's where it kind of extends into the daytime. Towards the morning hours, the brain recognizes, wait a second, I spent my whole night trying to help the breathing out, meaning in fight or flight. I got the mouth open, I'm moving the head a little, I'm moving the arms and legs, I'm repositioning this child, trying to get the breathing right. The brain recognizes, because of course we are on this circadian rhythm, we rise with the sunshine. So the sun's going to come up soon, our body kind of knows that, and it wants to wake you up. So with the rhythm of waking up with the sunshine, the brain says, wait, I didn't get to do my job. So what the brain does is, it says, oh, I'm not done cleaning myself yet. So then the brain will actually add ingredients that keep you asleep longer. So now you get these little ingredients. I need to extend the sleep a little longer to finish working on the cleaning part that I didn't get to. Now, what that does is it makes the morning description that a parent will say, my child is very difficult to get up in the morning. Like in the morning, they're super tired, they're excess tired, they don't wake up refreshed, and it's kind of a struggle to get going. That's because at the morning hours, the brain is trying to add to the sleeping component to finish its job.
Interesting.
But meanwhile, the wake cycle, the sunshine coming up, and the fact that we're supposed to wake up in the morning is starting to kick in. So there are ingredients that wake us up. But now if you got more ingredients to keep you asleep, guess what you need more of now to wake up? You need more ingredients to wake you up. So now those get excessive. But then the brain says, no, I'm not done cleaning. So this goes back and forth a little bit in the morning hours. But what happens is the wake drive or wake cycle ends up overloading or dumping the system, saying, okay, that's enough fooling around here. It's time to get up and go. The sun is out. So it overloads you. But when it overloads you with things that wake you up, now you're overstimulated. So the child goes from slow and sluggish and tired and dragging in the morning, right in the middle of the day when they're smack in the middle of school, hyperactivity, because you've been overloaded to overcome that sleep drive. Now you're hyperactive all afternoon, and with all those extra ingredients, you can't fall asleep at night. So sometimes there's a crash in the middle of the day, you're tired, you have some fatigue, the kid has to take a nap, they just crash because of all the excess energy. But sometimes that excess energy lasts longer and they have trouble falling asleep. So next thing you know, the parent struggles with this vicious cycle of, we just can't seem to get to bed on time. We're awake, we have energy, we're not really falling asleep. Then, of course, they will crash, have a bad sleep cycle, bad breathing, bad sleep cycle. Trouble getting up in the morning. We just can't get rolling in the morning But then we get the call from school, we're hyperactive, or we're hyperactive, we're bouncing off the walls, middle of the day. So this struggle is real. And it's thanks to the ingredients that are going on from this poor sleeping, and the body is just trying to do the best it can. But it's basically, there's a lot of dysregulation going on. You have too much and too little of things instead of balance. There's no balance. And so going high to low makes a different child. And the research was from Dr. Karen Bonnick. There's a wonderful research. She's brilliant. Dr. Karen Bonnick, Bonnuck, did a wonderful amount of research back in 2011 and 12 that showed a relationship between breathing, how you breathe at night is related to your behavior the next day. And she followed 11,000 children for like 6 or 7 years to show that the children who are mouth breathing or worse, they do have a higher association to the behavioral problems versus the children who nose breathe mostly at night. So yeah, mouth breathing or worse at night is unhealthy, and it does have an effect on the behavior for that child the next day. And I know we covered a lot of ground in there, but the behavior is related to the quality of sleep being deteriorated. And then, of course, that attention, focus, memory, cognitive change is the hoarder analogy. The brain is just overloaded, hoarded every day with nothing being filed or put away or cleaned at night. The cleaning isn't happening for the kids.
Yeah, that hoarding analogy is fantastic. And, I was thinking while you're talking, I know a lot of people, a lot of moms that are dealing with kids that have ADHD or this hyperactiveness, during the school day. But I don't think doctors or anyone say to them, wait, do you know if they're mouth breathers? And so I feel like this is something that's not very common out in the world, maybe in the, dental world, but how,
right.
Is this a common thing or is this new to people?
So there is a slight disconnect between the medical and the dental professions. And so because dentistry was pulled out of medicine, basically dentistry is its own field. So medicine doesn't really study the mouth very much. And so the oral cavity, the mouth, is left for the dental community. And so if something were downstream from breathing or oral cavity issues, meaning underdeveloped jaws, it's less likely that the medical community would be on top of that early. They're probably going to catch up at some point. And we do work with the medical community a lot to kind of build bridges and help. I'm currently speaking quite a bit to some doctors at Mount Sinai, where we're working on, papers and research to show that there could be a breathing component to this that should be looked at more often than not, because maybe there's another way to treat the children. It is how I practice in my office, in that I treat the underdeveloped jaws. I treat the malocclusion. But yeah, I think that the dental and medical communities, because the medical community doesn't really have the mouth in their training, there's a slight, problem there. And then the dental community has mostly always been focused on the teeth. And if you're teeth focused, you lose sight of the foundation. You lose sight of the entire, mouth, head, neck, human being. So to be tooth focused was the old days. And I'm hoping really part of this whole mission is to kind of get dentistry to fade more towards a foundation focus first. Because if we get the right size foundation, the teeth go where they belong, and then you can always have the teeth later. So I think we're working towards developing the medical and dental communities to be more aware of sleeping and breathing and the effects it has cognitively, behaviorally, all of these relationships, so that the children could, basically be seen earlier and have opportunities to become healthy by treating the cause, not the symptom.
Yeah, this is something that parents need to know. We just need to get this word out. In fact, I'm writing a post right now for Instagram about all the questions to ask your doctor if your child is dealing with ADHD. And now I need to write a section on there that says, or ask your dentist about mouth breathing and, airway, things like that. Let's take a quick break to hear from our show sponsor. Switching to a more toxin-free lifestyle is a challenge, and some swaps are harder than others. One of the swaps that has been hard for me is finding a laundry detergent that cleans my clothes and leaves them smelling good. Thanks to my loyal listeners and followers, I learned about Truly Free. Truly Free creates both laundry and home cleaning products for families who want family-safe, non-toxic cleaning solutions that actually work. Truly Free is free from chlorine bleach, phosphates, 4-dioxane, and harmful fragrances. I am getting the results I want without any of the dangerous chemicals. Truly Free offers refillable and reusable packaging, which empowers families to reduce their environmental footprint. Get real cleaning power with absolutely zero scary ingredients. Use code JUSTINGREDIENTS at trulyfreehome.com today. Now back to the show. Let's actually talk about maybe some solutions or some tips or things for people that have kids or spouses that are mouth breathers? Like, what can they do about this?
We have a lot of things at our disposal, and some of them are very simple and can be done at home, and then others you need like a professional to go to see to have training. So we'll talk about the differences that are available and kind of give like age groups that you can use them in as we go. Now, anyone can benefit from nasal hygiene. So nose hygiene is non-existent today. And so we think about, cleaning your nose so that it's clear so you can breathe well through it. At a bare minimum, everyone should clean their nose twice a day. So a morning and evening routine, and that would mean blow your nose nicely and maybe use some sort of a natural nasal spray. Anything that is simple saline or totally natural, nothing that is like chemicals and or medications. We don't need that on a daily basis. So a natural nasal spray. So I talk to parents and children about, okay, we're going to blow our nose first so we get it clean. Then we're going to put the nasal spray in there and give it a few minutes. It'll work. It'll start working, and then it's going to loosen things up. Then you got to blow again. And after you do the blow, spray, blow, basically what happens is you've got a clean nasal passage for easier nose breathing. Bare minimum would be morning and nighttime. You should clean your nose just like you clean your teeth morning and nighttime at a minimum. Can you do it more? Yes. Children and adults who struggle with maintaining, nasal breathing smoothly and easily, I tell them you can do it more often when you're using natural products. Feel free to do this every hour, every other hour. It's okay to clean your nose more often. The emptier it is, the better you will breathe through it. So nasal hygiene, number one for anybody. Then we get to a category called myofunctional therapy. Myofunctional therapy is good at any age. So any human being can visit a myofunctional therapist, and that is, I know myofunctional therapy, some people have heard of the word, some people haven't, but basically it's like physical therapy for the head and neck, and it involves breathing, posture, musculature. And what they do is they help to retrain all the breathing and musculature to have normal muscle patterns and work and function as opposed to dysfunction. So basically correcting dysfunction, because once we're mouth breathing, everything is basically dysfunctional and we're compensating. So myofunctional therapy applies to any age. That's a bonus there. Now, into the dental practice, you can start talking about guidance appliances. And so I have been using guidance appliances for over 2 decades in my practice. I say the words guidance appliance. Most people don't know what this is, but if you looked at one and held it in your hand, you would say, well, it looks like a football mouth guard. Or I could play lacrosse in that. I could play field hockey in that. Well, it looks like a little sports guard, but when the child wears it, it basically redirects. It starts to retrain the nose breathing. And when that appliance is in, it starts to retrain the tongue to function better. So the tongue should be functioning up and down loosely and then not so much side to side or front to back. So the guidance appliance helps for proper tongue function, which helps your growth and development. And when the guide is in, it also pushes back on the lips and cheeks, which when we're not breathing well, the lips and cheeks become hyperactive and they start working more. But if the inside is weak, if the tongue is weak on the inside and the outside is strong, we're going to grow the wrong way. We're shrinking instead of growing. So we want to push back on the lips and cheeks. So the guides kind of get in the way of the lips and cheeks. So we have nasal hygiene, myofunctional therapy, guidance appliances. Then let's say we meet, and guidance appliances are wonderful from 3 to 12. 3 to 12 years old, those are effective. But from 8 to 12, there are a lot of kids who could benefit from fixed expanders or removable expanders. So there's the word expander. I use a lot of expanders. I prefer fixed to removable. I know they both work. I have a lot of mentors who use removable. They work for them. So fixed or removable expanders, I like 8 to 12 as an age range because I've had such success with the guides between 3 and 7. But 8 to 12, fixed expanders or removable expanders, those are also helpful to get you caught up to where you should be. And if you can get caught up, you can breathe better. And if you can breathe better, you can sleep better. And if you can sleep better, you can heal. Then, of course, your teeth will start to fit in better. So you can have that pathway. Now you get into a little bit older category, teens and adults. All of a sudden, teens, there is a threshold where fixed expanders can work for them, but then there's a threshold where they don't. And that takes quite a bit of training to use fixed expanders in teens. So I'm not an advocate of that unless you've been trained by somebody who's done that a long time. But removable expanders do exist for teens and adults. And those are also pretty effective at helping someone. When you get to the teens and adults, again, nasal hygiene, myofunctional therapy, expansion appliances are okay. I've used a lot of clear aligners, but clear aligners are not a cure-all. Those are just helping get some tongue space. So clear aligners may not help your nose breathing, but it may help you have a little more tongue space. So I've used clear aligners to move the teeth away from the tongue. And when your teeth are crowded, they're closer to the tongue. So moving them away from the tongue can help you. Then, of course, you get into surgical procedures. There's a surgical category when you get a little too old and maybe, okay, well, I can't really move things anymore. Are there surgeries available? Yes. And certainly that category involves, well, CPAP machines exist. Appliances exist that hold the jaw forward. Surgeries exist. It gets a little more intense down the road. The good news is it is easiest to treat earlier. So my preference is to treat the child younger, because that's when you can have an effect on the growth and development of the jaw and make a bigger difference. It's harder to treat the older patients. They have options, but it's harder to treat them. And you got to find the right place.
Okay, good to know. But I'm curious about mouth taping, because you hear about it all the time. And I'm curious your opinion on it before I tell you my issue with my husband with mouth taping.
Okay. Yes. So mouth taping. Yeah, I'm not opposed to mouth taping, but I never start with it. And I'll explain why. And then this is all preference. This is just opinion and preference on mouth taping. So here's my issue with doing it first or early. So I believe when I see the crowded teeth that the jaws are too small. Now, when the jaws are too small, the upper jaw does build the nose inside. So if you're having trouble breathing, it means your upper jaw too small. You can't breathe well through your nose. But when both jaws are too small, your tongue doesn't have enough room. So when your mouth is closed, your tongue is back. It doesn't have the right parking space to be in. So my dilemma with offering tape early is that, well, the patient has small jaws, so they can't breathe well through their nose. And their tongue doesn't have room to pull forward and hide, so it's back. I believe that taping early without growing the structures means you're forcing bad nose breathing. So in my logical mind, I see that, okay, common sense, one step to the next means I'm just forcing this patient to breathe badly through their nose. That might not shut off the sympathetic nervous system, because to get to mouth breathing, the poor breathing of the nose was how you got. So I'm not a fan of just taping as the only or early solution. However, once you've grown the jaws, let's say you're doing nasal hygiene, you're doing myofunctional therapy, you're doing some orthodontics or orthopedics, you're doing things to make more room. Well, now as you're growing, you breathe easier through your nose. Your tongue has more room. Now, all of a sudden, you have a better breather on your hands, but they have been habitually mouth breathing for so long. To break that habit, yes, myofunctional therapy is very helpful, but can you do some mouth taping to support the lip seal and keep the nose breathing? Absolutely. So mouth taping has a place. I prefer to get into the mouth taping a little later, when you've already developed room, so that you're actually taping and helping someone breathe well through their nose, not just taping them and forcing them to breathe badly through their nose. So that's my take on mouth taping. Yes, but later.
I love that. And it makes complete sense. And I'm sort of laughing because I always tell my husband to mouth tape, but this might be his problem, is he doesn't have enough room in his mouth, because within an hour, the mouth tape is off and he's like, it doesn't work. Okay. My mouth just automatically opens up. So
yeah, so his tape is not holding him closed.
Yep.
Which means that his breathing is so poor, his brain is forcing him open to get the air in there. So basically for him, the mouth taping is forcing him to be such a bad breather that his brain is overtaking the tape. And the wrong thing to do there would be to get stronger tape. So as much as you want to, you should not be putting duct tape on him, because that's really bad.
Yeah, that makes sense. Okay, so I'm curious though, because you're talking about these kids that don't have big enough jaws, you keep saying. And so is mouth breathing mainly due to not having enough space in the mouth, or these underdeveloped jaws?
Yes, so that's right. There's a little sequence of events. And so, well, how did we get to be a mouth breather? Well, your brain automatically separates your lips to let the air in as a safety valve when you can't breathe through your nose well. So basically, we go one step before mouth breathing is poor nasal breathing. Well, how did I become a poor nasal breather? Why can't I breathe through my nose beautifully that my brain would allow my lips to stay together? Well, poor nasal breathing has to do with the jaw growth. So our upper jaw basically builds this triangle here where the air is going in our nose. So we have this triangle in there, and right beneath our nose is this triangle where the air is going to go in. Well, when our maxilla, upper jaw, is too small, that chamber looks like this. So we have a higher vault. If you look at our palate, the palate goes up higher, so the kids will have a vaulted palate. But the walls, the side walls, are part of the maxilla. So if our maxilla doesn't grow wide and forward, this triangle will be smaller. But the reason we don't breathe well through our nose is because the jaws are too small. Now, when the jaws are too small and we can't breathe through our nose, then we start to mouth breathe. And mouth breathing makes your malocclusion worse. In other words, mouth breathing will make your teeth and bite and jaw condition worse. But mouth breathing isn't the start of your teeth and bite and jaw condition. It was the poor nose breathing. So the jaws being too small is what triggers the mouth breathing. And the mouth breathing is another gallon of gasoline onto an inferno. That's what's already running. So the inferno. So now it begs one more question, which I think you're going to get to anyway. I'll just say it is that why are my jaws too small?
That was my next question.
If the kids have, in the children, a parent can know right away. If they have new teeth coming in, they're crowded. So crowded teeth with a bad bite is a visual sign that, hey, the jaws are too small. It's a foundation problem. The teeth are a symptom. Now, in the baby teeth, it's less common to see crowded teeth. What you see is baby teeth together. They're beautifully stacked together. There's no space. So no space in the baby teeth is trouble. There's big crowding coming. So 3 to 5 years old, if you don't have any gaps between the baby teeth, and there's supposed to be a gap between every single baby tooth. If you don't see gaps between the baby teeth, the jaws are too small. Now, why are the jaws too small? It turns out the jaws grow primarily by muscle activity. And the muscle activity of the jaws would come from the hard diet. So there's a incredible load of anthropology research that shows how cultures transition into that Western industrial early soft food, or baby food, as we call it. Well, the softer the food, the weaker the muscles. And the weaker the muscles, the less there is the stimulus for the bone to grow. So when we use in the Western industrial cultures the early soft food, we're taking away muscle strength and work. So the muscles are weaker, but they're also not functioning the same because you're drinking that food. You're not chewing that food. And so basically when the muscles are weaker and dysfunctional, our jaws don't grow the same and you get crowded teeth and bad bites. It's all pre-industrial, pre-Western anthropology research shows that all cultures, pre-industrial, pre-Western living, go from breastfeeding to hard foods. The baby food, the mush, is an invention. That's an invention. That's not a natural pathway. So transitioning 6 to 9 months old into harder foods that the child grabs and gnaws on, when you have the early hard diet, the muscles are worked hard. When the muscles are working, the bone is growing. And that's why cultures that have early harder foods do not have crowded teeth or bad bites or any really type of inflammatory or types of diseases. So we get back to, okay, we're starting out, most of the children today start out with early soft food. So early soft food, weaker muscles, dysfunctional muscles, less bone growth. Less bone growth here means smaller nasal chamber and less room for the tongue. And when this is collapsed or smaller, we don't breathe as well. So the breathing issues that are going on, whether it's mouth breathing or worse, is really due to underdeveloped jaws, thanks to what I would call a self-inflicted wound of an early soft diet that, the research is out there, the anthropology is out there, and very few people know about it until you come across it and read it. I didn't know it a while ago. Then I met anthropologists who have studied this for decades. And when you go to their meetings and you hear them talk, it's undisputed research that shows that you get crowded teeth, bad bites from smaller jaws thanks to early soft food, changing the muscles. So once you change the muscles, we're on this pathway of trouble. Here comes trouble.
Yeah, that's really interesting. A lot of my kids are in their 20s. And as you're talking, I'm like, yeah, back when I had babies, it was you blended everything. So everything went in my blend tech and their meal went in the blend tech and we made it nice and smooth. And that's how they ate it. And watching my nieces raise their little babies now, they don't do it like that. They let them gnaw on things. And I'm like, oh, good for you guys for learning this.
Yes, it's out there. When you start digging, you can find it on Instagram and stuff. Think places like Solid Starts and others like them, baby-led weaning category type stuff. You start learning about, hey, an infant can handle the harder, bigger chunks. So obviously you don't give it a grape, and there's the wrong shape and size to give it. But when you follow, because again, the baby doesn't come with an instruction manual. Who knew? I did the same thing, with our kids. We got the blender. We went to the farmer's market. We were like, oh, we're getting all the right stuff. And then I blended it to a pulp. And now, of course, you have to be dad of the year. So I blended till the blender caught fire. Like I figured, how will I know it's right? I figured, look, if the blender catches fire, it's got to be the right consistency. And I'm blending this stuff to liquid. And sure enough, I did it all wrong with my own children. And so, yeah, the idea is learning about it. So I encourage people to look into baby-led weaning and Solid Starts to start to learn patterns of feeding infants earlier, because there's a pathway to solve this. But again, that's a societal change. And you know how difficult that is to change.
Right.
A full societal change is tough. So it could take a generation or two to really swing this back. And that would be a perfect world, because I don't want to be trying to save all these kids from their poor sleeping and breathing, but we do have to start working on them at 3 because it's already visible and they already have the symptoms. And since they're already struggling with symptoms and have visible or not going to grow enough, we should help the jaw growth early, because that's when you have the opportunity to do it.
I was going to say, that's why it's so important to catch this mouth breathing as young kids, because it's so much easier to fix a developing jaw as a child than trying to fix my husband's jaw who's in his 50s.
Yes, the choices are less and harder as an adult. And so while he has options, it's much more difficult. You want to help the children early. That's the real pathway. It's helping the kids early to grow and develop better. This way you get your jaw growth early, get your breathing back, get your sleeping back. You can heal. You're treating in the cause category. Otherwise, and I say it like this, you can treat the cause early or you will treat the symptoms forever. Nobody escapes bad breathing. You are going to deteriorate and you are going to treat the symptoms downstream forever.
Okay, so I have a question about all of this. Is it more than just maybe an underdeveloped jaw? Can it be something else like would like tongue ties play a part in this?
Yes, and they do. And backing it up into it, it's for the same reason. So it shows in the research, and a lot of this came out of Stanford with Dr. Christian Guilleminault, who showed that affecting tongue mobility, so reducing tongue mobility, which is what a tongue tie does. So a tongue tie is going to reduce your tongue's mobility. Reduced tongue mobility is a direct cause of underdeveloped jaws, which is then, and when you're putting the dominoes together, so you have reduced tongue mobility, now you have the risk of having your jaws underdeveloped because the tongue's not working properly. But underdeveloped jaws is the risk factor of the breathing. So now you have your sleep disorder breathing category. So yeah, the frenum, if it's too tight, if your tongue is tight, it can't do its job. So you may have a tongue tie, and a lot of kids do. So since that is another diagnosis to make, part of referencing the myofunctional therapist is that's one of the best specialties out there for diagnosing tongue tie. And as well, speech language pathologists, every lactation consultant, the breastfeeding category, all of those professions are very good at recognizing tongue tie, and all of them are helping the children. So you have a number of different categories where, yep, there are people out there helping the kids making that diagnosis. So yes, having a tongue tie means you could do everything to try to move and correct, but it wants to come back then. It wants to relapse because the tongue can't be your natural scaffold or architect to keep it that way. So we do have to make that diagnosis a little bit better and get treatment for the kids. Otherwise, you're working against the body's own natural way. You do want to release tongue ties when it's diagnosed as appropriate.
Okay, that makes sense. So what about, though, I've heard people say like, oh, I mouth breathe because I have a really small like air pathway. Is that a thing?
Yeah, this is true. So the jaws, when the jaws are too small, it reduces your airway. So now we loosely say the word airway. You have this airway, but airway is your space to breathe. And there are the professional words for your airway. The starting point is your nostril and your nasal cavity. So the nasal cavity is part of your airway. And then after the nasal cavity, when the air goes in, it has to turn around. And it's going to go through these three words. And it's the nasopharynx, oropharynx, and laryngopharynx. But basically, those long professional words are reduced to one word, airway. So your airway is the space you have from your nostril down to your trachea. What am I breathing through? Is it a garden hose or is it a coffee stirring straw? Well, that space is dictated by how your jaws grow. So you have beautifully well-grown jaws, you will have a bigger space to breathe through, a better airway. But if you have underdeveloped jaws, and we would see underdeveloped jaws as crowded teeth, if you've got crowded teeth or you don't have all 32 teeth where they belong, you have less space for your nose and tongue, you have a smaller airway. So the people who say, yeah, I don't breathe well because I don't have a good airway, it's accurate. It's an accurate way to say it. And a lot of the lay terminology is correct in that, yeah, the jaws are too small, so that space is smaller.
So if you're an adult, it's too hard to expand that jaw, so you've just got to use devices or something that's like help during the night, correct?
Yep, for an adult, at the top of the list is a CPAP machine, because the CPAP machine kind of forces the air to go in and out without any obstruction. So a CPAP machine. After that, devices to hold the jaw forward. If you hold the lower jaw forward, the tongue will be forward and the air gets by better. After that, there are expansion techniques for adults, and they come in different categories, surgically and non-surgically. Now, surgically, yes, an adult can have surgery to open to open things up and breathe better. That exists, and those are a little more invasive, but do work. Then you have the non-surgical category, which is trying to help that bone grow by stimulating it appropriately. I use a fair amount of removable expander devices for adults. It's very slow going, and it takes a dedicated effort of wearing them appropriately to actually get the bone to grow a bit. And when it does happen, they get relief of their symptoms, not a cure. I can make improvements, but I'm not curing anybody of OSA that way. Clear aligners can give your tongue more space. And if giving your tongue more space makes an improvement, you can make an improvement. So you have from surgery to clear aligners, basically the most invasive to the least invasive. And it's a conservative approach to make an improvement, not to cure or solve. And I know there's a lot of people who they get bent out of shape when I say, oh, you're going to use clear aligners on an adult with apnea. Well, why not? Because I'm not trying to cure their apnea. I know their teeth are crowded and they're closer to their tongue. I just want to move the teeth away from the tongue and give their tongue as much room as I can. There's nothing wrong with that. I gave your tongue more room. And now I've seen over 2 decades, they will improve. So I've never said I treat OSA, and I've never said I cure OSA, but we have conversations with patients and it's about informed consent. These are the choices. And when they don't want to have surgical procedures and they struggle to wear their CPAP, which is quite common, not many adults are looking for jaw surgeries, and a lot of adults do struggle to wear CPAPs. Well, why would we say, oh, clear aligners are bad for you? No, let's just move the teeth away from the tongue and see if that helps you at all. And if it makes an improvement, great. I find more often than not it does.
Okay, I've heard you, I think it's you that talks about the tooth pillow. What is that?
Tooth pillow, it's a cute, affectionate name of a company. And so like your head has a pillow when you go to sleep, your teeth should have a pillow when they go to sleep. But the little guidance appliances I referenced before from 3 to 12, there are these guidance appliances that can help children to retrain breathing and musculature to behave properly. And when you use those in conjunction with nasal hygiene and myofunctional therapy, you can have wonderful, outcomes for kids. Well, 2 decades of using them in the office, treating patients clinically in my practice, that's a lot of kids that we treated. And about 10 years in, a decade in, I had so much information, I started to teach it to other doctors. So back in 2011, I started teaching about these guides to other offices that wanted to learn. And basically then they could use it in their communities and help kids early. Well, that then led to fast forward another 8 years. And all of a sudden, people who recognize this is really working very well decided to have a conversation about, is there a pathway to do this remotely? Meaning, what about all the kids who have no access to this? Because very few dentists around the country actually use guides and myofunctional therapy to treat children early. Well, that's a true statement. There's no access. What about affordability too? Might be able to solve both things. So Tooth Pillow was kind of born out of a mission to solve 2 things. One, accessibility. Could a parent anywhere look into this and decide, I think I would like to help have my child have that? And affordability, could it cost less if we did it remote? So remote, our big fancy professional word is teledentistry. But remote is taking the model that I've used in my office for 2 decades of treating children coming to see me and translating it into, can I do this remotely without them visiting me? So we incorporate 3 things. It's the nasal hygiene, support, techniques, products, things that you can do on a daily basis to keep that nose clean. Second is the guidance appliances. The guidance appliances can be sized and delivered by photographs. And we have a proprietary little card. The parent takes a picture. I can see the picture. I can tell you, oh, here's your guide you would need for this age. And sure enough, that can be mailed to them. And the third thing is myofunctional therapy, which can be done via Zoom. So myofunctional therapy can be done via Zoom. A lot of myofunctional therapists do this. There's a demand for that because right now we don't have enough myofunctional therapists. We need a lot more of them. And there should be one everywhere. In a perfect world, there'd be one next to every orthodontist or in every office and in every dental office or next to one. You'd have a myofunctional therapist everywhere. The child is, in need of the service. But can they do it Zoom? Yes. So Tooth Pillow is guides, nasal hygiene, myofunctional therapy wrapped into a remote process where a parent can find us. So let's say they're listening somewhere and they learn about this and they go to the website. There's a website, toothpillow.com. Parent looks in there. We put a lot of information, a lot of the things we're talking about, so that the parent could learn all about these connections and then decide, if, this might be good, let me pursue it one step further. That's where the tab is my child a candidate? And is my child a candidate will open up some information I need about the child, a sleep breathing questionnaire. So it's a very long questionnaire, probably a good 25, 30 items with open boxes so the parent can tell me about their child. And when they select their choices, we ask about how is the breathing at night? Do you hear snoring? Is there labored or difficult breathing? Are they mouth breathing? Do they pause or hold their breath at all? Is there bedwetting, ear infections, night sweats, nightmares, behavioral category? We got all those. There's a lot of things to tell us about your child. And so we know, are they struggling with symptoms? Then, of course, the parent sends me photographs. So we answer those questions. The parent answers the questions. Then they take some pictures. They take pictures with their phones because they can see the teeth. You can look in there. You can get enough photos so I know, just screening the child, is this a child that I could treat remotely and have a benefit, or does that child need to go to an office? So myself and one other founding member, Dr. Kelly Hale, also a brilliant provider of guidance appliances for a decade in her office, we screen these children, and there's a percentage of them that can be treated remotely. We can get them an improvement and they have no access rate and it's supportable. And then there's a percentage that I have to deny, and it's always painful saying, no, I can't help you with tooth pillow. But then once we do the denial, we do try to connect you to a local, someone in your community that is paying attention to airway growth and development. So you could avoid the alternative to that, which again, we're always trying to avoid extracting teeth and going the other way, because making the mouth smaller is not helpful. So I try to caution parents, please don't let anybody extract any teeth, because that's the wrong direction. Let us help you find another location. You just need another consultation. So yeah, Tooth Pillow was built for access and affordability. It turns out it's a fraction of the cost to do it remotely. And a lot of, there are some people who can fly to see me, and that's, wonderful. Oh, they'll fly from somewhere to see me for treatment. Great. But I know for every one patient that can afford to fly to see me, there's probably 10 or 20,000 more that can't afford to do that. And since there are very few of us around the country, we felt like this would be appropriate to do. And it has proven now to be, we beta tested we're in our third year, and it has proven to be very effective at helping children have an opportunity to grow and develop a little better earlier.
Well, I'm glad I asked you that, because my next question was going to be, okay, I know I have these moms that are listening that are maybe going to go see if their child's a mouth breather because they're dealing with ADHD or bedwetting or things like that. And I was going to say, but if they go to their regular dentist, a lot of dentists aren't going to even know what they're talking about, correct?
That's correct. A lot of the dental community is not in the airway growth and development space. So while we're getting there, more of the dentists are aware about adults who have sleep apnea, because they can make the positioning device. That's a little bit easier to get into. Whereas with children, it's about growth and development. So with growing and developing, you have to do a little bit more. And not every dentist is up to speed on that. So there's a chance you might ask at your dental office and they might not have the right answers for you. And it doesn't mean they're bad or wrong. They're a good dental practice, I'm sure. But you might need to then keep searching for someone. And here at Tooth Pillow, we do have doctor locators to at least give you some guidance. And in a lot of communities, I've trained a lot of people to do this. So there's a chance we have someone near you where you can go for in-office treatment. And we're happy whether you reach out to Tooth Pillow and we can help you, or we're happy to get you into an office that we know might be able to help you as an in-office technique. That's fine too. We're just happy the child gets treated earlier, because the options early, I know it's almost ridiculous to say, but the options early don't exist when you're 13.
Yeah, that makes so much sense. Well, I am so glad you've been on the podcast today, because I know this is new info for people, and I think it can really help some parents, because I feel like there's so many kids out there dealing with ADHD. And I know there's a lot of different root causes for that, and for the anxiety and the bedwetting and things like that. But this is a great root cause to look at. And so I'm really glad you're here to teach us. And I know people have learned a lot. So thank you so much for taking the time to be here. But before I ask you the last question, because I always ask my podcast guests what they have found to be the best ingredient in life. But before that, I know you said to find you at toothpillow.com, but are there other places on social media that they can find you and learn from you as well?
Yes, there is. Tooth Pillow has an Instagram, so you can check us out at Tooth Pillow Instagram as well. And then at Dr. Ben Miraglia, I have a long list of recorded videos in short segments that describe the connections of all the things we see, symptoms downstream, like you were listing off, related to the mouth breathing and how that all works. So it's very informative for parents to be learning. And that's the most important part, is to learn so you know you have options.
Like he said, if you are a parent or have, someone with these issues, go learn. That's the best thing you can do, is educate yourself more, know what your options are out there. So thank you again for being here. And so now you get that final question. What have you found to be the best ingredient in life?
The best ingredient is silent and invisible nose breathing. I believe that's a pathway to health. I know there's a lot of ingredients. It's never one ingredient, but at the top of my list is silent, invisible nose breathing. That's how a human being stays on the healthy track. And then, of course, a long list after it, but that's where I would start with.
I love that. And that is perfect for what you do. So that is a great ingredient, and an ingredient that many people probably don't think about. And so this is good new awareness for people. So again, thank you so much for taking the time to be here, and everyone go give him a follow and check him out at Tooth Pillow. And thank you again for being here.
It's my pleasure. Thanks for having me.
Thank you so much for listening. Remember to subscribe to the Just Ingredients podcast to learn more about your health and good ingredients to life. Plus, get daily tips at just.ingredients on Instagram.